Hello everyone, my name is Dmitry Starchik. I'm very glad to congratulate you with the beginning, but sorry, for you it is the ending of the second semester. And today, the last lecture we have for human anatomy. And it's my pleasure to see all of you, even 4 person, but now 5. That's good. And as you remember, at the end of the first semester, we have a lecture on X-ray anatomy. For musculoskeletal system, and after we have lessons in angiology, we studied heart, we studied arteries, veins, a lot of inner organs, etc. And now it's time to see how this structure look by X-ray and CT and MRI scan examination. Okay, so let's start. Please let me know if you are able to hear me clearly. That is very important for me. And just send me a message with improving that everything is correct with our technician. Yes, nice, very good. Thank you. Hello, hello, Tarek Favi. You are a little bit late today. Well, okay. So let me start this demonstration. And as I thought before, in that final lecture we will study internal organs, and large vessels for head, for neck, for chest, abdomen, and pelvis. I recommend you to take patients because that is very important part of human anatomy. What you absolutely will need when you come in clinic, because this is the very popular methods for examination, for patient examination, and for diagnosis a lot of diseases. First of all, I'd like to remember you that modern medicine offers an impressive list of X-ray diagnostic methods, and some of them are very old, like X-ray examination, and some of them are very young, like magnetic resonance imaging. It is the youngest radiation research method. But all of these methods use a special physical power, like electromagnetic ray. Especially X-ray. This is we call it Röntgen radiation, as well as CT scan, fluoroscopy, contrast radiography, fluorography. All of these are used use X-ray radiation, but only magnetic resonance imaging using the electromagnetic fields or another. Honestly, Röntgen ray and electromagnetic, it is the same electromagnetic radiation, but in the different frequencies. Well, let's remember you the some of the technique for X-ray examination. That is, unlike visible light, I hope you know that X-ray path through our body, and the research object usually is placed between the X-ray source here and here is the receiver. For this scheme, this is the X-ray source, and here is the receiver. When X-ray pass through the body, they come here and go down. Some of the rays are absorbed, some part of the X-rays are absorbed or let in the body, in organs, and only that part coming through the body hit the receiver. This device, I call it receiver, transform X-ray into electrical signals that are displayed on the screen. Previously, maybe 30, maybe 40 years ago, instead of the apparatus, instead of the device, it was the film with the silver salts that was used as a receiver, because X-ray started chemical reaction in this silver salts, and after some procedure with another chemicals, it became visible. Now no film, only special receivers, and it is very easy, and it decreases the volume of X-ray examination, and it makes its light. It's easy. It's better for our health. And another idea you should remember, that X-ray is a two-dimensional image. I mean image when we get in after computer analyzing of the X-ray passing through the body. That is a two-dimensional image. But the object, of course, is a three-dimensional object, and that is associated with a projection layering of various anatomical structure. It plays in the two-dimensional image and have different drawing and different shape. So to be please be ready and get skills to read and correctly interpret X-ray image. It is not easy, but after some practice you will be as a professional röntgenologist or professional doctors. Let's go forward, and I'd like to show you the another method using X-ray examination, X-ray radiography. It calls contrast radiography. What does it mean? Most internal organs absorb X-ray at the same rate. So, if you want to see an individual organ like stomach, you need to fill this organ with a radiopaque contrast substance. Here, this is the white color. That is shadow. We call it shadow. That is special barium sulfate, which is like a glue, and we ask patient to eat this substance, and it make stomach visible. So this technique is called contrast radiography. As I said, for contrasting hollow organs like stomach, like intestine, small intestine, large intestine, etc., esophagus, we used barium sulfate. To contrast the urinary structure, special solution are used in, and it is injection in the veins, and after some time this solution is excreted by kidneys and make all of like urine. It is urine really containing this special contrasting solution. And another way to use intravascular injection, this fluid, contrasting fluid, and allows to see blood vessels like here, visible arteries of pelvis and femoral arteries. If you take a look of right picture, you see the difference between right and left side or arteria femoralis. Here it is some restriction. And here is also visible, but on the left side the femoral arteries is normal. So it is easy, and this method we call contrast radiography. It is very useful for examination internal organs and vessels. Then I'd like to show this picture again. This is a picture with the technique called computed tomography. More often we call it CT scan, like here. And this computed tomography is a modified method of X-ray examination. It is very important research method in the clinic, especially now during the period of the COVID-19 pandemic situation. All of doctors use CT tomography to study lungs in the pandemic areas. The first computed tomography scan was created in the United States in 1972. This figure shows the first image in California. It is the first image of the shoulder joint here. It is not very good, but it was possible even in 1972. Unlike ordinary X-ray imaging, the CT scan image is obtained when X-ray emitter moving around the human body, and it starts some portion of X-ray, and those signals are analyzed by a computer, which produced an image that looks like a cross cut of this area. Here it is like cross cut of the head. So we could see the structure if we froze the human head and take a saw, band saw or ordinary saw, and cut the head. So we will see the structure inside. But for patients, of course, no cutting. It is just computer and analyzing this procedure when X-ray emitter moving around. As far as I know, there are CT scanners in some anatomical departments of some European universities, not in our university, but I hope we will have CT scan someday, especially when we start teach foreign students, like I am doing now. Okay, please see this table. This is the resolution CT scanning when doctors change sensitivity of CT scan receiver. It gives us the bone option when very good when bones inside of our body are very good to see. They are visible in the maximal resolution. Then this gap of sensitivity gives some organs, soft tissue. It's visible here, visible heart and muscles, and the less sensitivity of CT scan receiver. When we use the less sensitivity, we get such lung options. When lung, inside lung, visible all structure, bronchus and lung tissue. I have to tell you about spiral computer tomography. It is the same method, but when the emitter, X-ray emitter, go around the body, but not not as a circle, but as a spiral, like hop, 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 and etc. And we get three-dimensional objects, and this way we can study three-dimensional anatomy. It is also very popular and very useful now. In the last, I show you magnetic resonance imaging, or MRI scan. In comparison with the CT scan, this method is younger. It was invented also in California, in the United States, in 1977. How are such images obtained? That is not X-ray. I hope you know that all of biological structure, every biological object is placed in contains water, and when it is placed in a strong electromagnetic field, this causes polarization of the hydrogen atom in the water molecule. Even each water molecule take a special position, and when the electromagnetic field is turned off, each water molecule generated its own electromagnetic radiation, which is recorded by modern computer. In other words, on MRI we see the glow of water molecules in the different organ and tissues. And MRI scanner looks like a CT scan, but with a longer tube. Here is visible that the tube is longer, not such as the short. CT scan is like here, but MRI scan is longer twice. And this method provides high resolution when using images in different planes. Here it's not only the transverse plane, but also in the frontal section, in horizontal and sagittal. Here is the frontal section of whole body. And doctors use MRI scanning to see internal organs and soft tissue because they are visible better than on the CT scan procedure. Now it's time to start how organs of the head and neck look like in the X-ray examination. See here a CT scan of the nasal cavity. This is the level of cutting, and we see nasal septum here, number one. That is also three concha. In Latin, concha nasalis superior, concha nasalis media, and concha nasalis inferior. And visible some structure and ethmoidal bone. And this is a black shadow. This is the air inside of bone. Here is the number two. This is a maxillary sinus, the largest sinus in our head and in the body, and also. And that is how we can evaluate the symmetry of the nasal septum. Here it is symmetry, and all of meatus, nasal meatus, like superior meatus, inferior nasal meatus, and middle nasal meatus and inferior nasal meatus. They free, and air can pass through the nasal cavity without problem. Another examination, X-ray examination, are used for dentist, and we call it ORTO pantomography. You see the all teeth for upper jaw and for maxilla and for mandibular, because that is a special procedure when the X-ray emitter go around, and the receiver we put in the mouth cavity here. This is a receiver, and it is X-ray come from here, because emitter go around of our mouth and make all teeth visible. What we see for this picture, this is of course the dentist incisivus 4. This is dentist canini here and here and here. And we see also radix dentis and even cavity of dentis. Here is no molars, the last molars here only, and here I think that is the after surgery operation, when it was take out of the alveolus. Another special technique, X-ray examination, we use for details picture of each teeth. Visible the here is visible the corona dentis. This is the cavity of dentis, and the cavity of radix of dentis. Also, we see periodontal membrane here. This is the soft tissue which fix every dents inside of bones of mandibular, and special part of mandibular near around each of root, each of radix dentis, we call lamina dura, because it is hard, it is strong lamina in our jaws. Another picture is a computed tomography of the oral cavity. This is a CT scan in frontal and sagittal section. What we see inside? Here in coronal section we see some problems with the picture. I don't know why here. Here is no digital, only barcodes here. I don't know why, because in my computer everything is correct. Okay, and here we see tongue and lingual septum inside. hard palate here, tongue here, and lingual septum. Mandibular, number 4. Here is mandibular. Muscles between processus processus spina mandibular and tongue, we call genioglossus muscles. Also platysma and mylohyoid muscles here is visible. In sagittal section also we see hard palate, number 1 here, and this is a soft palate. This is a soft part of the upper wall oral cavity. Tongue with the muscles, septum lingual, here is a genioglossus muscle, mylohyoid muscles number 6, and hyoid bone here, and mandibular in sagittal section. I hope you recognized all of this structure. For salivary glands, we use a special method we call thialography, when we use some contrasting solution and inject it inside of each duct for glandula parotida or parotid gland here, or in submandibular duct here. And visible all of this duct, and it helps for diagnosis some diseases of salivary gland. Orbital. Let me take another picture, because you didn't study organs of sense and central nervous system, so we see this picture later in the third semester. Lateral neck X-ray examination, we see number 5. This is hyoid bone. This is cervical vertebra, and number 4 is the air inside of pharynx. We call it laryngopharynx. Here is nasopharynx. This is the upper part of pharynx. Then we see oropharynx, number 3 here, and the lower part of pharynx we call laryngopharynx. Also visible epiglottis, number 6 here, and this is the air inside of larynx. Also visible prevertebral face and trachea. This is the tube what connects larynx with the main bronchus. MRI of the head and neck in horizontal section. Here is the level of cutting, and this is the nasal cavity with nasal septum, sinus maxillaris here, and this is the nasal nasopharynx or nasal part of the pharynx. Also visible ramus mandibular and other organs here. Sagittal section of the head and neck. For head we call it, but for neck this is the trachea, muscles on the front of vertebral column. Here is the spinal cord, and between them is cervical vertebra, the body of these structures here. Neck in horizontal section for MRI. Visible laryngeal cartilaginous. Here is the cricoid number 2, but here is visible digital, very strange. And the cricoid cartilaginous here, and also we see thyroid cartilaginous number 1. It is like two plates make angle, open posteriorly. And we see also internal jugular vein and carotid artery here, and even prevertebral muscles. Interesting that on the left side we see structure which is abnormal or pathological. This is an abscess. This is a container for fluid with microorganisms, and this is a very dangerous situation because it is near to the main organs in the neck. So surgeons need to cut it and evacuate this solution out. Chest, X-ray anatomy for this part of the body. We use usually a typical anterior projection when people stand face to the emitter, and we see organs of the chest, like heart. Here is the heart, a shadow heart. Here is great vessels, aorta first of all, and we see two lungs, right and left here. You maybe should ask me how I evaluate that is the right and this is the left, because heart commonly takes left position. So I'm absolutely sure that is the right lung, and here is the left lung. And we see different structure. I don't want to tell all of them here, but it is a special drawing here and here and here. This is the bronchus and great vessels. I'd like to show the chest ray examination in lateral projection. It is also visible heart here. This is the aorta. You also see thoracic vertebra here and even ribs. Now I'd like to demonstrate you contours of the bronchus, heart and blood vessels in this picture. If we start examining this image very carefully, we could see such structure. This is heart shadow here, and this is the bronchus in green Here's the bronchus, trachea, and two bronchs here. And it is in blue, this is the vessels. So it is very easy. Just you need some experience to analyze all of such structure, and it will be no problem in the future for you to see and examine patients. I'd like to add that it is a normal picture, normal image of lung here. But I show you some pathological examinations. Here is a focal pneumonia. Very often we see such area in white, and we call it shadow, because lung tissue is infiltrated with fluid, and it is made not transparent. And when we examine patients who has COVID, we often see pneumonia areas in around all of Bronchus. Here another disease, pulmonary tuberculosis. This is spots, small round spots in all of lung, in right and left lungs. It is very hard situation. It is not good for patient. MRI of the heart in the horizontal section. Usually it takes on the in the level of third ribs. We see such a gross large vessels, the largest vessels in our body, we call it aorta. Then this is a small gap between pulmonary trunk, and here is the pulmonary trunk, and it go right to the right pulmonary artery and left pulmonary artery, and this is a gap between aorta and pulmonary trunk. This is also vena cava, superior vena cava. It is coming to right atrium, and also oblique sinus are visible. This is if you see this picture, this is structure. It is also aorta. Here is aorta number 1 and aorta number 5. How it is possible? Because aorta first it goes up and then go down. So we see in the picture two parts of aorta. The first is the ascending part of the aorta, but number 5 is descending. It goes down. MRI of the heart in the oblique sagittal section. That is a special projection. It is showed in this scheme, like here, and we see all cameras, all parts of the cameras of the heart cameras. That is right and left atrium. Between them is interatrial septum. Then we see right ventricle here, and left ventricle. You see that the wall of the left ventricle is larger than in right ventricle. And we also see mitral valve. It is number 6. I think that is not correct. It's not mitral, it's tricuspidal, because that is the right ventricle, and this is the right atrium and right ventricle. Between them is tricuspidal valve, not mitral. Very interesting picture. You can see all cameras of our organs number 1, like heart. This is a projection of the heart valves in frontal and lateral projection, but telling true, that is not visible. The valves are not visible without contrasting method. It is just only prediction where they are located. CT scan of the chest in horizontal section. This is a level of thoracic vertebra number 5. You see also aorta, ascending and descending. It is the same picture, but it is also visible lung tissue. This is an option when we don't see lung tissue, because that is a special option to see only soft tissue like heart cameras and muscles, etc. CT scan at the level of the T8. This is 8 thoracic vertebra. We see also all cameras, right ventricle, right atrium, left atrium, and left ventricle, and all structure. Here number 6. This is a mitral valve. Here is correct, but number 8. This is what is it? Papillary muscles. No. So it is not visible tricuspidal valve. It should be here. Here mitral is visible, but tricuspidal is not. Okay? Contrast aortography, when we inject some contrast fluid. Here is a tube, thin tube, which come from the femoral artery, and inject contrast fluid into the ascending aorta. This is a special spheroid structure. That is the aortal valve, semilunar aortal valve, and this is when MRI. This is MRI with injected cameras, heart cameras, also visible such structure like ventricles, like left atrium, etc. Here visible when aorta come from, it goes out of the left ventricle, so blood moves from atrium to the left ventricle, and then from the left ventricle it comes to the aorta. And this is also visible 3 largest vessels, arterial vessels in the aortic arcus aorta. This is a this is a truncus brachiocephalic trunks. This is a left common carotid artery, and this is a left subclavial artery. X-ray examination with contrast radiography, also visible these three large vessels. This is a brachiocephal trunk here, number 6, that is the left common carotid artery. At 7, it go to the upper limb. This is the left subclavian artery here, number 6. Radiography of the esophagus. Here we see the barium sulfate. This is the liquid coming through esophagus in the upper part, in the middle, and in the lower part of these organs. Also visible the folds, longitudinal folds, and visible that some of the narrow part of esophagus near the aorta, and when it comes to the stomach. This is special sphincter or special muscle rings which prevent food coming back to the esophagus. This is a disease, radiography esophagus diseases. Schatzky ring, special narrowing of the lower part of the esophagus here, and it protect it doesn't allow food come to the stomach, so the esophagus is large and has problems. Nobody knows why these diseases started. What is the reason? What is the cause? What cause these diseases? Next picture. Very rare situation when esophagus has special recessus, or we call it diverticule here. And this is a tragedy after, this is a stenosis after acid. You maybe ask me what kind of acid. Usually it is after suicide when people try to drink acid, and they stayed alive, but get difficult stenosis after that burning. We call it chemical burning here. Don't do that, never. X-ray anatomy of the abdominal organs. We see, first of all, it is interesting to see how the stomach looks like. We see stomachs with the barium sulfate, and we see all parts of the stomach, all stomach parts. Fornix, number 1. Then that is the body here, and this is the pylorus. This is the border between duodenum and stomach, and this part we call pyloric part or pyloric antrum here. And you could nicely see the folds, and you see also the two angle. First is here, and we call it geese angle. between esophagus and stomach. And also we see the stomach angle or angular incisure. This is usually show it is connected and combined with the constitution or with the body constitution. And X-ray doctors who are very good in analysis of X-ray examination usually call this is a bigger part of stomach. We call it saccus digestorius in Latin because it usually contain digest or food. But this the lower part of and small part of the stomach they call canalis egistorius or canalis evacuatorius, because this part of stomach evacuates food from stomach to duodenum. And I remember I'd like to show you different constitution different shape of the stomach in different constitution, different we call in other words somatotypes. Here normosthenic usually they have a hook shape like a hook here. For asthenics that is that like a stalk, but for hypersthenics this is the people who are very short and strong, like Michael Tyson, maybe, you know, and they have horn shape for like a horn. So three types: hook, stalk, and horn, for different somatotype, for different constitution. And I'd like to show you in comparison with normal picture. I show you the ulcer. This is a defect of the stomach wall, and the body sulfate come into and make it contrast. And also show you the cancer. Here is no fluid in some part, and usually the border is transparent, very transparent. That is, I think this is a cancer not very difficult because it is still small. And after gastrectomy, when surgeons take the bigger part of the stomach out, this it is a picture like here. This is a small operated stomach, and this is a duodenum, etc. Okay. X-ray examination of small intestine. You see this typical picture of barium, sulfate barium inside of small intestine, and you see this is a very long structure, about from 4 to 5 meters long. And that is also in another patient, but nothing bad here. Only a lot of section, a lot of a lot of intestinal tubes inside of abdominal cavity. This is a colon X-ray examination. More often, doctors call it radiography. So when barium inject through the anal canal, and usually visible cecum, ascending, colon ascending, colon transversum, colon descending, sigmoid colon, and even, of course, rectum. This X-ray examination. This is it combines barium sulfate and air. Here the some segment of large intestinal contains air, but some of them contains barium sulfate. It's better for diagnostic some problems. Now this is only air pumping. This is to when air inject or come into the these hollow organs, and all of their parts are visible. CT scan abdomen in horizontal section at the level thoracic 10. This is a 10 vertebra of the thorax. And you see such organs like liver here. You see the vein. This is the largest vein in our body, and also we see the aorta, descending aorta. Usually inferior vena cava is larger than, has more bigger or larger diameter than aorta. And you also see spleen here, and stomach. Yeah. Well, this is level thoracic 11. The same organs, but you also see the kidneys, right and left. But this is the metastasis. When cancer cells come into the liver and visible these spots, that is the cancer, which is start from some organs, more often from the colon, and then these cells come into the liver and progress inside of liver. CT scan at the level of L1, lumbar thoracic. Here is lumbar, but this is between thoracic 12 and L1, and you see also right kidneys and left kidney with a sinus inside of. You see also spleen and liver. Here visible number 13. That is the pancreas, body and tail of pancreas. Very important organ of digestive system, and that is I hope you remember, that is the endocrine organ which produce hormones. CT scan of the abdomen with the ascites. This is a pathological situation when usually it is after virus of hepatitis. This virus damaged liver, and the water come through the vessels from the veins, especially from vein, and come into the abdominal cavity. So abdomen cavity is big. All of this, this is the water fluid, which is difficult for patient, and surgeon need to evacuate this fluid from abdominal cavity. MRI of the liver on the frontal section, you see the liver, that is right lobe and left lobe. Here is a portal vein. This is quite big. This is portal vein. Here number 6 portal vein. Sorry, not 6. I think that is the portal vein here. And duodenum, of course. This is part of duodenum. CT scan abdomen in frontal section. Usually you see all of organs of abdominal cavity, even vertebra and pelvis. So here is heart, liver, spleen, kidneys, psoas muscles, and etc. Surgery after ectomy of the gallbladder, they use examination of biliary tracts. They inject, here is the injection tube, and they inject all of biliary tracts inside of liver, and even this is choledography. But take a look here. Why they do that? Why they do such examination after operation? Because sometimes the calculated or stone from the gallbladder is hidden in the common duct, and if surgeon stay this stone here, it will be a big problem for patients. So they need to inject contrast fluid and find such hidden stone. This is an arteriography of artery mesenteric superior. This is a big and very important artery. Here is angiography of inferior mesenteric artery. They usually transport blood to the descending colon sigmoid, and even for rectum. Excretory urography, usually visible the calyx minor, calyx major, and pelvis renalis, and also visible ureteries. Here they are like a puncture line, dotted line, and even you see the number 12. This is the vesica urinaria with a contrast fluid inside it. This is also excretory urography. But what this is a patient with scissors what was left after surgery operation. It's pity, but I think surgeons need to reoperate these patients and take the scissors out. X-ray examination of the pelvic organ. As you know, pelvis organ for men and women have a great difference. Here is see MRI of male pelvis and see such organs like urinary bladder, prostate gland. This is the penis. This is the rectum here, and this is what we call perineum. This is muscles what fix all organs and prevent them from the falling down. Male pelvis with MRI examination. This is pelvis bone. Here we see urinary bladder, some part of small intestine, and this is a sacrum or sacrum. Here another level. This is 11S5. It means it is level 5 sacral vertebra, and you see this is acetabulum with femoral head inside, articulatio coxa, we call it in Latin. Also you see urinary bladder, rectum number 16, and also this is the seminal vesicle, left and right. It's male organs. Female pelvis in sagittal section. You see number 13. This is a pubic bone. Here urinary bladder with a small amount of urine, and this is number 4 uterus here, and cervix of uterus. It is very good visible here. Vagina number 8, vagina, and rectum here. So female pelvis in horizontal section by MRI. You see all of this structure, urinary vessels, uterus, and rectum. And special contrast examination when doctors, gynecologists inject some contrast fluid in through vagina to uterus, and contrast uterine tube, so to see if they are free of pathological process, and oocyte has no problems to come into the uterus from the ovaries. This is angiogram iliac arteries, common arteries, and internal and external arteries. And after they go out of pelvis, it transform into the femoral arteries. And foreign bodies inside of pelvis cavity. This is I think it is some patient with problem with the head problems, mental problems. But this is even mobile phone in rectum. So now that's all I'd like to share you to demonstrate in X-ray examination. I hope it was useful for you. If you have question, please send me in forum. Today today we don't have any special task. I wish you everything good, and hope to start lecture in the third semester after some pause. I don't have the schedule for the third semester for you group, but I hope it will be very soon. Okay, nice. It was nice to see you again, and be ready to prolong your practical lessons with your teacher. Thank you and goodbye, my friend.